Today we are talking about lip filler. People ask me, am I a good candidate for lip filler? In my opinion, almost, if there is no contraindication, anybody with any age, with any size, any shape of the lip can get lip filler. Why? Because there is no standard shape, there is no standard size in the lips. Lips come in different sizes, so whatever size you have, whatever shape you have, you can change it, they can go bigger. I have done lips on the 21-year-old and I have done lips on the 70-some years old. And everybody likes the result. So basically everybody at any shape of the lip, any size of the lip, they can get the lip filler. People ask me, okay, I want to have natural looking results. I tell my patients that's the expertise of the injector. If the injector has enough experience and if they follow the technique that we recommend to follow, that's going to be the most natural looking. And then basically rule of thumb is that, avoid putting big blibs of the filler. Try to make it like micro, teeny tiny droplets and then spread it out. So it has become, it will have the least chance of becoming lumpy and bumpy. How long usually the fillers last, lip filler lasts? I tell my patients, pessimistically, about 3 months, optimistically about a year. So most of the people follow somewhere in this range of between like 3-4 months up to a year. Ideally, about 9 months to a year, but on the average is about 9 months the filler lasts. The other thing that I have to add to this is that after 9 months, it doesn't mean that the lip filler is completely gone and off the body. Every time we do lip, any kind of filler, big part of it will go away over the course of time, a small part stays there. So I tell my patients, every time we do filler, it will last longer and longer time. So what it means is that a big part of the filler will go away, but a small part of the filler stays in the body for longer and longer time. So I tell my patients, usually the first couple of sessions is going to be more close to each other, but as the time goes by, you kind of space it out longer and longer time and then go to the maintenance, which basically kind of maintaining the shape and then the size that you desire. The beauty of the hyaluronic acid filler is that if I do your lips and if you don't like the results, I can easily reverse it with the hyaluronidase. That's the enzyme that breaks down the hyaluronic acid. And the result of the dissolving is going to be almost immediate. Within a couple of minutes, you're going to see the filler is gone. About the recovery time, I tell my patients the recovery time, it differs from the patient. It's going to be different from person to person, but usually going to have like a little bruise here and there for like 2, 3, 4 days, 5 days, and the result's going to be gone. About the side effects, people ask me, okay, what are the side effects of the fillers? In my opinion, the most common side effects are not because of the filler. The most common side effects are because of the needle. We have to use needle to be able to inject the filler. So the most common side effects are the results of the needle. What are those? Infection, bleeding, bruises. Then we're going to go to the side effect of the fillers. Sometimes fillers can become lumpy and bumpy. Sometimes fillers can become uneven. The same way that we have dexterity in our hands, we have dexterity in our facial expression muscles as well. Nobody almost speaks completely symmetric. So we use one side of our lip maybe more than the other side. So I inject the filler completely even on both sides, but one side starts deflating faster than the other side. That's out of my control. Very, very rarely can happen that the body will mistake the hyaluronic acid with the foreign body. So what it means, instead of thinking, oh, this is a hyaluronic acid in the body, it's a natural product, it'll start thinking, oh, there's an enemy inside the lip. Let's go confront the enemy. Let's go contain the enemy. So they make an inflammation on the lip, on the filler, around the filler, and after the inflammation is resolved, it's gone. Filler becomes something kind of stone hard. Most of the time is not visible, but cosmetically, when you feel your lip, you're going to feel some lumps and bumps inside the lips. If it doesn't bother you, we can leave it alone. If it bothers you, we have to remove it, basically. And very, very, very uncommon, extremely uncommon, is what we call intravascular injection. So what it means is that while the injector is injecting the lip, if they don't notice that they're injecting into a vessel, specifically any artery, they can go and clog the artery. The job of the artery is to supply blood, and they carry blood around. So if that artery is supplying blood to the lip, part of the lip can have a problem. If that artery goes and gets connected to the artery that supplies blood to the eye, can cause blindness. word blindness, it kind of scares people, but I tell them, the results that I could find, how many times, how many patients have gone blind. The only thing that I could find in the studies was a study published in 2019. As of 2019, out of this study, basically they searched and looked about all different kind of injectors, all different side effects that happen worldwide. They found out that 54 patients have reported to go blind. So the odds of going blind with the filler is extremely, extremely uncommon, but has happened before.